What I personally care about is that every single human being, totally ignorant of your race, gender, socioeconomic status, legal status as a citizen or non-legal citizen right now, that you have access to health care and basic needs, whether it just be vaccinations, mental health, all things of that nature, because if you don't have access to those resources, you cannot then add to our society. You cannot get a job, you cannot have a full education, you can't support your family. So we can't expect that of people and say that they can't have certain quality of living if we don't provide those resources for them at the root of our being. So I think there's been a lot of different things, whether it be during COPE programs with India or in Brazil, when I studied abroad, but most recently when I was home for winter break, I worked at a nonprofit healthcare clinic that was specifically geared toward veterans, people experiencing homelessness, and then AIDS and HIV positive males. And those three groups have really high levels of uninsurance, like they're usually not insured. And so working with those populations who are super vulnerable, especially during the wintertime, and seeing their situations when they came in and how a majority of people at Stonehill, a majority of people that I interact with on a regular basis have all these things and take them super for granted, and then veterans that have served our country don't have access to those rights, or people that have been trying to get jobs and trying to work, try to have an education, don't have access to that because they can't be healthy, because they can't go into a regular hospital and just say, I need this, this, and this, because they can't pay for it. So watching that happen on an everyday basis and seeing how our work impacted their lives to make sure that then they could pay their rent, or they could go back to school, or they could do this because they had basic health care, was kind of where I saw all of that come together in a domestic sense and in a personal sense as well. Many things, I think, but I think ideally where a lot of my interests and passions come together is like class structure and socioeconomic status breakdowns. So the reason people don't have access to healthcare or education or XYZ is because that there are these structures and institutional violence that takes place. And if those could be broken down, and not a totally, equal communist society, but if structures could be broken down so that people can have at least the same starting blocks and equal access to opportunity, then I think we could be in a way better place than we are right now. Hi, my name is Sara Morris. I'm from the class of 2016. Let's lead for justice.